There's no question that in the United States we need reform in medical care. First of all, if you look, compare us to any country in the world, we're about twice as expensive as any other country. And yet we're not getting quality for money. And healthcare is now reaching proportions where it is growing so fast it is getting out of the reach of the middle class. It really is a disaster. And it also affects jobs, because if you look at the average car that comes off the assembly line in Detroit, you've got $2,000 worth of medical expenses built into that car that a comparable Japanese car doesn't. So it's hurting us across the board. But the problem is that the bill and the proposals that are coming out of the Congress right now don't deal with the issue. And if you notice the rhetoric that Obama had, when he started this whole process, he was talking about getting the costs down. He doesn't talk about getting the costs down. He's now talking about the insurance aspect, because the bills that are currently in front of Congress don't touch the core problem. They're putting the cart in front of the horse. They're dealing with the insurance, which is merely the payment mechanism for insurance, as opposed to why are costs going up in our system as fast as they are? Why are they as high as they are? It doesn't deal with the frivolous lawsuits, which tort reform would touch. It doesn't deal with the incentive structure for doctors who are incented to give you more and more tests. It doesn't deal with wellness in the whole system. We treat symptoms as opposed to, what is the sort of trajectory of a person's health.
It doesn't deal with end-of-life expenses.
It doesn't deal with a lot of things.
But
it's just an ad
that's
hoc.
the conflict. You have conservatives who will accuse the liberals of wanting something that will let grandma die, and yet refuse to deal with tort reform. The liberals, on the other hand, saying, look, 90% of health care dollars are spent in the last 6 months of life. You got to really get real with that.
Sure.
And they want to make sure that you have some protections in the event that there's malpractice.
Sure.
How do you bridge those two?
It's tough. It's really tough. And you know what? Not one country in the world has done it right. We keep hearing comparisons between ourselves and Japan and France and Switzerland. Not one country in the world has done it. It's a very, very tough issue. But this bill doesn't begin to address it. What it's doing is it's creating an entitlement with monies that we don't have. I tell people this all the time. This is not a rhetorical statement. This is not an exaggeration. America is on the road to bankruptcy. In 10 or 15 years, we're going to see, if we stay on this road, we are going to see America begin to default on its obligations, on Social Security, on Medicare, on Medicaid, just like California is now defaulting on its obligations. There's that old saying, how California goes, so goes the rest of the country. Well, it's on the horizon. And if we continue to add cost after cost after cost, we're just accelerating the process.